Good evening, everyone. My name is Dr. Shelby Wolf, and tonight I'm presenting a little Q&A on telehealth and psychology. So this is meant to be your need-to-know guide, a little bit more about telehealth in general and how that applies to the field of psychology and what we do here at ICANN in regards to telehealth services. So I always like to start off with a fun Fred Rogers quote. His quote is, "When we can talk about our feelings, they become less overwhelming, less upsetting, and less scary." I feel that applies very much so to both kids, or not both, but all of kids, teens, and adults. The more we talk and share things, the better we take care of our emotional and psychological well-being. So that's a goal here at ICANN in terms of psychological services that we provide, making sure that we're all focused on wellness and well-being. And I think um, Fred Rogers says it the best here. So today's objectives, what we're going to talk about is what is telehealth in general. Like I said, very much so not a new technology, but is something that we're often seeing now, especially in times during the pandemic. I'm going to talk to you about how psychology and telehealth look together and being available wherever you're at, talking to your child. So, whether you're a caregiver, parent, or even another behavioral health provider, or work in the field with individuals with autism, neurodevelopmental disabilities, or other behavioral health concerns, how you can prep for an appointment with someone on our team, such as myself, via telehealth in the psychology department. We're really going to talk about what services are offered, and I'll kind of highlight some specialty areas of my own. We'll talk about parental and caregiver involvement and engagement and behavioral health activities, especially during telehealth. But in general, parental involvement is one of my favorite things about my job and what I do for a living. And then we'll also talk about how evaluations for such things as autism spectrum disorder might look a little bit different via telehealth, but it is still possible, and what best practices look like according to the latest research in our field. And then I'll leave it open at the end for any questions and answers. So a little bit about me, so you know who is talking with you today. I have my PhD or doctorate in school psychology. So I have experience in school settings and clinical settings. I'm considered a licensed clinical psychologist. So I'm a licensed psychologist both in the states of Washington and Minnesota. I'm a board certified behavior analyst doctoral. So some of you may have heard the term BCBA in the field of autism or applied behavior analysis. I'm a BCBA as well. And I'm also a nationally certified school psychologist. So like I mentioned, I've had a lot of experience in school settings, helping school teams with children who have special learning needs. So that's an area that's near and dear to my heart. And I'm just overall passionate about working with children with neurodevelopmental disabilities and lots of different behavioral health concerns in general. So what is telehealth or telepsychology? So here on this slide is a very long jargon-filled definition from the American Psychological Association of how it applies to psychology. But I'll talk about it just very briefly in terms of what it looks like and what it possibly looks like at ICANN. So it's really defined by using telecommunication technologies to provide these services. So most people, if they've had a telehealth experience, are most familiar, very similarly to what we're doing right now, right? We're having an interactive experience via Zoom currently, one platform you might use for telehealth, and oftentimes is considered synchronous. So just like now, even though we're recording this for other audiences at a future date, a lot of telehealth appointments are what's called synchronous. It means it's happening live. It's a live back and forth conversation, happens in real time. But sometimes telehealth can also be asynchronous as well, where as a family, if you're a provider that is working with a child, and let's say someone from psychology is zooming into you to provide some kind of consultation, um, you might even do asynchronous, which is more of a recording you do beforehand, And then the psychologist or behavioral health practitioner use that recording at a later time and then follows up later to provide feedback or what other information is necessary after watching that video. However, as I mentioned, most are synchronous. So, like I said, just think real life live action, it's happening live. And we usually use audio and video. So, again, popular platforms are Zoom, might even be Microsoft Teams. And there's a lot of other softwares out there as well. What's really important to note, though, when having telehealth appointments, something really important is HIPAA, right? HIPAA is our protection and privacy. Really centers around confidentiality, and the platforms we use at ICANN are HIPAA compliant, and you want things to be HIPAA compliant so your privacy is respected or protected, I should say, and respected as a practitioner, provider, and most importantly, as a client or family receiving services. However, this definition does talk about some other options that fall under telecommunication. That broad term can really encompass anything related to tele, which is telephone or communication. So that could be telephones, it could be mobile devices, video conferencing, email, chat, text, social media. However, mostly in the field and what we do at ICANN is that audio and video platform so you get the most out of your services. But those could be other options that you see in the field, and especially with technology evolving these days, I'm sure is something that will keep progressing over time. So what do we use right now? At least right now within our psychology department, we use Zoom. So I say, let's keep it simple. All of you today are on a Zoom call. It's pretty easy to use. And that's what we want to make things, right? When we're working with families or other providers, to make things as easy as possible and really not have technology be a barrier, but something that is really easy to use for both families, caregivers, and as I said, providers as well. So why choose telehealth, right? There's still the options nowadays to go in clinic and receive clinic services. There's a couple of different things to consider when choosing telehealth. So the pretty obvious one is almost zero travel is needed, right? You can be in your jammies on your couch if you wanted to. You could use your phone, you could use a tablet, you could use your laptop. However, sometimes in psychology, it may be necessary to have an in-person appointment if the provider deems necessary. It might be necessary to gain more information about your child or what is happening in his or her life. So it may be necessary, but oftentimes most appointments that are scheduled, not a lot of travel involved. Really, it's nice as well because you can connect with a psychologist, such as myself, when you're away from home, right? So, a lot of times we also work on, which I'll talk in a couple of minutes as well, about parent coaching and parent training. So, as a caregiver or as a parent, you can also learn skills to help support your child. Well, we know in this day and age, sometimes work or other life responsibilities require us to travel. And what's nice about telehealth is that you don't have to miss appointments as long as there aren't other responsibilities conflicting with that. So you can really do telehealth from anywhere as long as you have a connection and a device to do so. Again, ability to stay in the comfort of your own home. You could be in your pajamas if you wanted to, wear your comfy sweatpants. But really, what's the most important thing to me and why I'm really passionate about telehealth and why I do it as part of my everyday job is really increased access to therapy for individuals with physical, medical, and or mobility disabilities. Just everyone of all different abilities, bringing people together and connecting them with a specialist when it might otherwise be very difficult to do so, right? We know that in certain geographic areas, it may be really far to travel to see a specialist, and that could be medical, it could be behavioral health, it could be other pediatric therapies such as speech, occupational therapy, or physical therapy. And a lot of times as well, and in my experience, I've worked in very rural areas before. And a lot of times these are areas that definitely don't have enough behavioral or mental health resources. So we want to be a resource to everyone everywhere. So it doesn't matter where you live or where you're from, you'll still be able to access services. So a couple of other reasons why you might want to choose telehealth. Again, you might have access to a psychologist or another provider who has specialty training in all different abilities. So, right, that can include someone with a neurodevelopmental disability, such as autism spectrum disorder or ADHD, or maybe other chromosomal concerns such as Down syndrome. So, like I said again, hard to access specialty care sometimes. So, telehealth can help decrease that barrier. Sometimes people have difficulties attending in clinic sessions, might be due to other behavioral health concerns, could be a child, could be a caregiver or parent as well, such as post traumatic stress disorder or something called agoraphobia, which means it's really difficult to get out of your house due to a lot of anxiety. So, again, no matter where you are or what your family is experiencing, the purpose of telehealth is to decrease as many of those barriers as possible. Additionally, sometimes it's helpful to have telehealth appointments. Sometimes, depending on how you schedule them, you may feel you have more time to collect information about your thoughts, feelings, and behavior outside of the sessions. And of course, that flexible scheduling too. Like I said, you're able to schedule no matter where you are, as long as you have that device. So there's a little bit more flexibility because that geographic location you're at is flexible as well. So now I'm going to talk a little bit about you could even be a provider, caregiver, or family member, but how to speak to a child about behavioral health or psychology appointments, right? What we do is a little bit different than what a medical doctor might. So I break this down a little bit by age. So ages 2 to 4, really at this age developmentally, it's hard to understand why they might be visiting a behavioral health specialist or a psychologist. So if you're a provider or parent, and you know this appointment is upcoming for the child either you're working with or is your own child, really helping the child of that age feel comfortable throughout the experience. So when you come to the appointment, so of course, one benefit, as I mentioned, with telehealth, one comfy thing, hopefully, is that you're already in your own home or a natural setting to that child. So that obviously helps with comfort right out of the bat. But it's still to be helpful for children of this age to have something comfortable with them and really familiar. So that could be a blanket, a favorite toy, or a stuffed animal to hold during the initial appointment. And same goes for in clinic too. If there's something from home that makes you feel comfortable, those things are really helpful to have along. So really important as well. You really want to make sure, especially if you're the caregiver or parent, really reassuring the child as to where you'll be during the appointment, that you will be with him or her during the entire appointment. I find that to be most beneficial for children of this age. And also, as an important note to parents or caregivers at this age, because of developmental level, a lot of the work around behavioral health concerns really for this age is going to be around parent training and parent coaching. So, as I described that before, that is really giving parents tools to be able to help support their child with any concerns or challenges the child or family might be experiencing. So, really parent focus, but ultimately the goal is to help support the child during the therapeutic process. And again, being comfortable all along the way. However, as you get a little bit older, that changes, right? As our developmental age changes as well. So a lot of times, especially children between the ages of 5 and 6, for you can even think of medical appointments too, might become concerned about being separated from their parents. And depending on the concern, it might be helpful to observe or work with the child individually. So it's really helpful to provide a little bit more information or in-depth info about the behavioral health professional they're about to visit. So there might be some anxiety around doctor, what kind of doctor am I going to see? Or what's a therapist? What do they do? Just really reassuring the child that a behavioral health specialist is someone that is a safe person to talk to, and really framing it in the light of like a wellness checkup, right? Just like we would do at a pediatrician's office. However, right, Me as a doctor, I don't give any shots, I don't prescribe medication, so I'm not that kind of doctor. So oftentimes, if you tell your child you're seeing a doctor, it's helpful to reassure that not of the medical kind where you might receive shots. And if you're doing it via telehealth, it's done in the comfort of your own home in front of a computer or device in the home setting. At this age too, a lot of times it's really helpful to have parents involved as part of that therapeutic process. And especially, your behavioral health specialist will work with you to come up with an individualized plan for your family and your child. And they will let you know, what that involvement would look like, the frequency of it as well, and how often you will meet. So again, very similar where you want to be there to support, be there for comfort, but a little bit more explanation is involved, especially being a little bit older. Again, ages 7 to 11, very similar. There might be more anxiety or concerns coming up about this appointment, especially if a child of this age knows what a psychologist or a therapist or a counselor does, right? It's really hard. Like I talked about in the beginning with the Mr. Rogers quote, talking about feelings can be really scary and really hard for children and adults. So, really, focusing on that reassurance, I would even focus on, kind of giving a timeline beforehand. So let's say your appointment was next Monday, I would let them know today, about a week in advance. Children of this age really appreciate having time to ask questions and really encourage your child to ask questions too. What does a psychologist do? What do I do in this type of appointment? And if you weren't even sure either, feel free to reach out to us as well. We can provide some guidance in terms of what steps look like, which I'll describe today as well, but just to help ease your anxiety or your child's anxiety if there is any. So, here, oftentimes at this age, especially becoming a little bit older, this is where at least me as a behavioral health specialist, I might start to do some more one-to-one or individual work with the child just because of their developmental and cognitive abilities. They're really able to participate and get a lot out of therapy at this age. However, right, meeting a new person sometimes, especially over telehealth, you don't know this person, might be a little bit unfamiliar. Oftentimes, it's helpful to give the child a choice of, hey, can I have parents with me, a caregiver with me, somebody else I feel comfortable with, or deciding to be alone. So oftentimes we will want to work with the child alone at some point to do all of that great work, whether it's related to anxiety, mood concerns, other behavioral health concerns, but allowing your child, time and also just reassurance throughout this process is really important. So the last age group, right, kind of the latter end of childhood years or adolescence, here, right, it's really important to have the teenager or adolescent involved in that planning process with their behavioral health provider. So, again, really encourage your child to ask you questions about what the appointment might look like, but throughout the whole process, too, I think that's highly important. And beyond that, right, besides asking caregiver or parents questions, really having the adolescent be comfortable and encouraging them to ask their clinician questions as well, right? They are the main participant in therapy here. And we really want to make sure at this age, privacy is respected, right? During this time in a child or adolescent's life, there's a lot of changes going on with school, with our bodies. So we really like to respect that. So again, there's the choice here of being able to work with a clinician independently, which a lot of adolescents choose, but it's completely acceptable to be flexible, to have parents with as well for support. That is completely okay. But also, parents, if a child, an adolescent is seen independently, as parents should really communicate that it's okay and often a very, very good thing to have confidential conversations with a clinician to help build that rapport and work on things together that might be hard within, a family unit. Sometimes when we're with our family, that's our comfy zone. And we may or may not see things that are important. So sometimes having that third party can help in terms of, helping with those behavioral health concerns. Um, However, I always like to mention, and I always state this at the beginning of the therapeutic process when I meet an adolescent and or parent or caregiver, that yes, privacy is respected and so highly important in the therapeutic process, but ethically and legally, as a therapist or a psychologist, we do have some limits to that confidentiality. So, really sitting down with teens and parents in the beginning to let them know that yes, it's highly encouraged and we want to have those confidential conversations with your teenager or with your adolescent. However, if the adolescent talks about intending to harm themselves or others, that is something where, legally and ethically, we can break that confidentiality to keep the child safe. So individuals we would, talk to right away would be parents or caregivers. And really, again, that is to maintain safety. And before that happens, usually after an adolescent may disclose something that could be harmful to themselves or others, I usually come up with a safety plan with that patient, but also talk about a plan of, okay, how are we going to let mom and dad know this information? Because I think that's also a huge part of that rapport and trust, right? We want a lot of those conversations to be confidential. That's why we talk about it in the beginning of, here are some things where we really do need to tell our parents or caregivers. And if it happens, hey, let's come up with a plan so we could talk about it with them together. Some teens and adolescents don't want to talk about it with the behavioral health clinician present, which is completely okay. Then, for example, me as a psychologist, as long as the child or adolescent knows that ahead of time, I will work with their parents to make sure the child is safe. Of course, safety is our number one priority. That's a little bit about, what we look for when preparing individuals for behavioral health appointments. But it's really important to know, right? What kind of services do we offer via telehealth? So I like to talk about it in two different branches, right? In terms of services that are offered. So I offer psychological evaluations via telehealth. So this can be for ones that I commonly do are autism spectrum disorder, or ADHD, which is attention deficit hyperactivity disorder, or other mental health concerns too, which could be depression, anxiety, obsessive compulsive disorder, lots of different things. And I put an asterisk there because that's what I talked about a few slides ago. So sometimes via telehealth, and depending on your child's age, there may be an in-clinic appointment needed just based on your child's needs and that individualization to testing and care, but also to best practices in our field too, which I'll talk a little bit about at the end, how that may look a little bit different for telehealth rather than a traditional assessment that would be done completely in clinic. Then the other branch of services, which I absolutely love as well, would be considered psychotherapy for clients and or families in general. So different modalities of therapy that I use, if any of you are familiar with these terms, and feel free at the end when we do a little Q&A, ask me about them or reach out if you want to know more about these treatment modalities. They're all evidence-based and research supported. So number one, I usually provide behavior therapy. So as I mentioned in the beginning, I'm what's called a board certified behavior analyst or BCBA. So I often look at things from a behavioral lens, but again, tailor everything, including my treatment approach, to every single client based on need and good fit. Something else that I practice is acceptance and commitment therapy, very popular term and very well researched. Therapy in the field of psychology is cognitive behavioral therapy, or known as CBT, and also dialectical behavior therapy, which is also known as DBT. So again, if you're curious to know what these therapy modalities look like, just reach out to us or ask questions at the end. I'd be happy to answer any questions about those. And then, a lot of those, are kind of the methods used for working with individuals one on one, can be done more in a group format as well. But I also offer a lot of parent training and parent coaching. So, as I said, if it is a younger child that's participating in therapy, and right, especially via telehealth, it's too hard to sit in front of a device and focus for extended period of time, or just based on the behavioral health concerns, it makes more sense for parents or caregivers to be what I call an agent of change, right? You're going to be the key person in the household to help support your child. So, giving you the tools and strategies needed for success. So, lots of different services are offered via telehealth. And again, just ask questions if you are curious about, evaluations or therapy. So I kind of am going to cover a lot of these. I'm going to go relatively quickly, so we have some time at the end for questions. The areas I listed here are things I've been specifically trained in, kind of my specialty areas, but we have other psychologists and therapists on our team who might address issues outside of this as well. So this is not an exhaustive I can list of behavioral health concerns that we can address. So again, just reach out or ask questions. But specialty areas that I have are working with individuals with autism spectrum disorder, ADHD, OCD, anxiety and depression, as I mentioned. One of my biggest areas of like passion and just a lot of experience is behavioral challenges. So whether someone has an autism diagnosis or not, I really have a passion for helping families with physical aggression, running away or elopement, tantrums that happen often, or self-injurious behavior. I mentioned I'm a school psychologist as well by training, so know a lot about the school system and conducted a lot of academic intervention in my time. So I often meet and help with families with that, bullying and anger, and it's not limited to there, but I also have training with trauma, medical compliance, or complex medical concerns. So that would be things such as having a special medical condition and needing to take certain medications for it, but the child or adolescent doesn't want to comply with that medication regimen, really helping the family help their child adhere to a specific medical routine, pediatric pain, sleep concerns, feeding concerns, behavioral parent training that I talked about already, mindful parenting strategies, right? So sometimes as caregivers, it can be really hard to be present in the moment if we have a tantrum going on next to us. So mindful parenting strategies would be really learning about being in the present and kind of focusing on bigger picture things rather than getting caught up in that moment for a tantrum or other things maybe going on. Language development and training, adaptive skills such as getting dressed, brushing teeth, following a school routine, and just skill acquisition in general. So, learning new skills that might be difficult or maybe due to developmental delays is definitely something we can work on together as a team. So I will kind of leave you with this bit of information. So I have this slide on here just because it's a big passion of mine, but I really think, as I put on here, the ultimate key to success is parental and caregiver involvement and engagement. And that's something I could shout from the rooftops and could talk about all day, but having no matter who it is in a child's life, anybody there that is helping support the child, be an active person in that therapy process, even if the child is seen individually, just so they kind of know general framework of what the child's learning. But if the child is younger or the behavioral health concern also warrants active engagement, it's really the ultimate key to not only child success, but how together you can grow as a family and overcome any challenge that is put in front of you. The last thing I'll cover really quickly is just what an evaluation may look like via telehealth. So this is kind of the process right now for autism spectrum disorder evaluations via telehealth. And this is the process we use um, currently. So it all starts off here first with a psychological consultation. And that's where you would meet with me or another psychologist on our team to find out a little bit more about what some of your concerns are and really what brought you to see a behavioral health specialist in the first place, really gathering good developmental and medical history just to find out more. Then the next few steps can go in this order or in a slightly different order depending on the patient and family, but we might do what's called an ADIR interview, and that stands for Autism Diagnostic Interview Revised, and as a very structured interview that asks about autism specific symptoms. So that might be social skills, communication, any inflexible or rigid behaviors. And that's a tool that's actually what's called normed. So based on how a parent or caregiver responds, it looks at responses compared to a child of the same age. So does this fall within typical realm of concerns, or does that go a little bit beyond that? It provides us more information. We will have a caregiver. It could even be a teacher as well for evaluations, fill out a rating scale or assessment. So for telehealth, that's something that's usually emailed to the person filling out the form. Some of them can be very long, so set aside some time when you are about to complete those, and with your behavioral health specialist as you're going through questionnaires, feel free to reach out if you have questions. And then the other component that we do either at home via telehealth or in clinic is what's called either the tele-ASD-PEDS, which is used for children 3 or under, and the BOSA that can really be used for age 2 through adolescent, and that's usually done in clinic. These activities are structured observations done via telehealth that are often facilitated with a caregiver there, and the clinician provides instruction on what activities to do. And in your home, you can use favorite toys of the child, and we'll coach you through those different activities. If you're doing the BOSA and are in clinic, it might be a set of toys that are already provided, and we will coach you every step of the way. So again, if you were seen for, let's say, the tele-ASD-PEDS, which is a research supported tool to perform over telehealth for diagnosing autism, we still may require an in-person testing session if we feel like we didn't get enough information or just more observations are needed. And then the last step is providing any feedback. So really going over the results of the evaluation and what we found. And then the most important part is any clinical recommendations of where do you go from here. So with that being said, that's all I have for you this evening. So I'll leave it open now for a couple minutes to see if there's any questions at all, and we'll go from there.
Hi, Dr. Wolf. I have a question. If you are working with a parent doing something like ACT, what would a typical treatment time look like for that? And how frequent would those sessions be?
Sure. You mentioned ACT specifically?
Yeah. Or I guess consulting
Yeah,
like regarding anxiety.
Oh, yes, definitely. That's not a problem. So I would say typically for most modalities of therapy, sessions can really last depending on the child's age, and thinking about their developmental level can last anywhere from 30 minutes to an hour. And for specifically, not really any specific time limit associated with it. But what I will note about product is that a lot of it involves more in-session practice than other clinical or therapy modalities. So really, as you're working with the client, assessing their comfort level to practice different activities or mindfulness activities during this session. Um, so not really time focused specifically. So depending on the client, and even if it's anxiety, really depends on what those symptoms look like. I would say, provided the example of anxiety, depending on what those exact symptoms look like, or in terms of frequency, I would generally recommend on starting at once a week for that 30 minutes to an hour. And then, as progress is made, being able to fade those therapy sessions and thin that out a little bit. So then you might move to an every other week schedule, depending on progress. Did that help to answer your question?
Awesome. Yeah, thank you.
Yeah, not a problem. Any other questions out there?
I have one.
Sure.
I was just curious, is there a part of the process that you do where telehealth might actually be recommended versus being seen in clinic?
Yeah, definitely. So I would say number one, especially with what is going on in the world right now, telehealth is a really great way to stay safe during the pandemic. So that's number one, just with what's going on right now. But general big picture, because telehealth is such an amazing tool for therapy, where it really might be recommended is if the child or someone in the family